A quarter of the world's coronavirus deaths have been in Latin America. A third of new infections are happening in the region. A region where just 3% of the population is fully vaccinated. So what's gone wrong? In some countries, people blame their governments for making the wrong moves or making them too late. Poverty, too, is playing its part, making social distancing impossible. Healthcare systems are overwhelmed and economies are shrinking. So what hope is there for Latin America? I'm Rob Watts in Berlin. Welcome to this COVID-19 special. Latin America is seeing an alarming rise in coronavirus infections. The region has the highest COVID-19 death rate in the world. Brazil has suffered the most fatalities with more than 500,000 deaths. That's followed by Mexico, where over 230,000 people have died. And Peru has nearly 200,000 dead, with a population of 32 million. DW's Johan Ramirez reports from Peru, where a new variant called Lambda has left the public health system there reeling.
In Peru, people are placing their hopes for curbing the pandemic on vaccination. Yet, progress is slow. Only some 15% of Peruvians have received at least one dose, one of the worst rates in Latin America. But for health workers on the ground, it's better than nothing. We feel optimistic because people react well to vaccination in Peru. In fact, younger people would like everything to go faster so they can get vaccinated soon. Although commerce has reopened after a 9-month quarantine, strict safety measures remain in place. Authorities have mandated using double face masks to enter stores and shopping centers. Face shields are widely used, and hand-washing facilities have been installed in the streets. But it has not been enough. Peru has the highest per capita death rate in the world. The government's response to the crisis has been widely criticized. The doses arrived too late. The management of the pandemic is a complete disgrace, especially for the previous president's one. Now at least the Pfizer vaccine has arrived. The last 2 peaks of infections in Peru have coincided with deep political crisis that, in both cases, led to massive demonstrations. The first one was in November, when political instability led to 3 presidents in 1 week.
The second wave of protests is happening right now. The reason? A controversial presidential election. One of the candidates cried fraud, while the other claimed there is a plan to steal his victory. Supporters from both sides have taken to the streets. According to some experts, these demonstrations could cause a further rise in the infection curve.
But at this point, the country cannot afford new lockdowns. The greatest effort must be done to vaccinate the population and to start negotiating from now on new generation vaccines for the new variants that may appear. This is the most effective measure, and we have been slow in doing so. On average, Peru administers about 350,000 vaccines every week, a low figure for a country of more than 33 million. Authorities have promised that the process will accelerate. A government forecast estimates that the eligible population will be immunized by the end of 2021.
The Latin American country with by far the highest number of coronavirus cases and deaths is Brazil. We've been speaking to Francisco Inácio Bastos, who is a senior researcher in epidemiology and biostatistics at the Oswaldo Cruz Foundation in Rio. He says the Brazilian government was too slow to accept the severity of COVID-19.
The main advisors of the government forecasted a very, very modest epidemic with less than 1,000 deaths. Now we have more than 500,000, and much probably in very soon we'll have something like 600,000 deaths. and also defined the clinical picture as a mild variety of flu, when actually COVID-19 is a very serious disease with many different symptoms and some very severe cases.
It's a very different disease indeed. I just want to talk a little bit more about Latin America, if we can. The Pan American Health Organization has talked about there being a glaring vaccine gap there. I mean, what's that down to?
I think that Latin America should be viewed now as a kind of patchwork, because we have very different profiles in terms of access and actual use of vaccines. So, for instance, there is a good performance by Chile, which is close to the developed countries from Western Europe, America, Israel, and other places. And Brazil procured and purchased the vaccines with significant delay. So now we are still below 14% of coverage in terms of the doses enough to protect people. So there is a big gap in Brazil to be addressed as soon as possible.
Francisco Inácio Bastos from Brazil's Oswaldo Cruz Foundation there. The health system in Cuba's Matanzas region is close to collapse due to the rapid spread of the Delta variant. Health workers say they're running out of medicine, oxygen tanks and respirators. The government has allocated 36 military doctors and 350 medical students to Matanzas to relieve some of the pressure there. Meanwhile, Cuba is expected to approve one of its vaccines against COVID-19 in the coming days. The regulatory go-ahead for the shot, called Abdala, could help speed up vaccinations across Latin America, where case numbers remain high, but countries are struggling to get doses.
A moment of celebration in Havana last month as Cuban scientists announced the results of their COVID-19 vaccine trial. The shot's 92% reported efficacy rate puts it in the same league as those developed by pharma giants like the BioNTech-Pfizer alliance, a remarkable achievement for a tiny island of 11 million people. Havana has 5 COVID-19 vaccine candidates in development. It's been vaccinating its own citizens since May, and last month started shipping shots to Venezuela, a point of national pride. We Cubans help others, things that other countries in the world don't do, countries that have more possibilities than we do, and we help those in need without any problem. Cuba says 30 countries have expressed interest in its vaccines. But public health officials and even politicians are urging caution. Cuba's state biotech firm hasn't published trial data yet or applied for approval from the World Health Organization. If this vaccine is approved by the international scientific community, we will welcome it. But it must be approved. We Venezuelans should not be guinea pigs. But with no end in sight for Latin America's vaccine shortage, some are being forced to choose between an unrecognized shot or none at all.
Now is the part of the programme where we put one of your questions to our science correspondent, Derek Williams.
In some places, cases rise, but deaths remain low. Why does SARS-CoV-2 seem to act so differently in different countries?
Pretty much all experts agree that pandemic statistics are influenced by a range of factors. So let's look at some of the ones that get mentioned a lot. One that's definitely playing a role nearly everywhere is the underreporting of cases, mortality, or both. Some countries are better at tracking COVID-19 than others, but in plenty of places, systems for counting and tracking disease and death are just inadequate, to say the least. And don't forget that political choices can influence how pandemic numbers are reported. Countries where the pandemic is raging, for instance, can basically write off tourism, which might wreak havoc with their economies. And that's just one of many possible reasons why politicians might want to play down infection rates. And speaking of politics, how effectively governments have responded to the spread of COVID-19 has also certainly played a role in whether numbers surge or stagnate. Then there's demographics. As a disease that's really deadly in the elderly, it seems logical COVID-19 would wreak more havoc in aging societies than it does in younger ones. Whether a healthcare system copes or collapses under the pressure when infection rates spike, that has also definitely had an influence on mortality in many places. And then there's the simple stuff, like just how a country decides to even define a COVID infection or a COVID death. There are plenty more factors that experts think are playing roles in the apparently different impact the virus is having in different places. But the final one most agree on at this point is vaccine inequity, which is a simple equation compared to many others. In highly vaccinated societies, death and suffering is tailing off, whereas in many countries with low vaccination rates, the virus might now be striking later, but it's striking very hard.
And that's all from this edition of the COVID-19 special. Until next time, take care.